Correct. With Liver Day coming up soon, there are some things that we need to know about liver disease. In general, we divide all conditions into the acute ones, the ones that come quickly and go away, and the chronic ones, the ones that start in an insidious fashion and then persist for a long time. Acute liver disease is easily picked up because most of these patients have jaundice. It's the chronic liver disease where the problem is, where patients are not aware of what's happening to them till it's rather late in the disease. So it's always good to know who are the ones who should routinely be testing or who should be getting themselves tested at least once in some time, the ones who are at higher risk of contracting chronic liver disease. So here the groups that we identify are, I'll just put them in a personal way. Number one, if you have been taking alcohol in any quantity on a regular basis, yes, you should get your doctor to periodically check your liver. Number two, if you meet any of the criteria for the metabolic syndrome, that is diabetes, hypertension, high uric acid, obesity, thyroid low. So if any of these criteria are met, then you should be getting yourself evaluated by a physician for liver disease. The third group is if you've ever received a transfusion with a blood or a blood product, you should get yourself tested, particularly for hepatitis C and hepatitis B. That way, we're quite sure we'll pick up a lot of people who did not know that they had this virus, remain on them for several years, and then manifested with late disease. So if you've ever received a blood product, please get yourself tested for hepatitis C and hepatitis B. And the last group would be those who have a family history, a close relative, a first-degree relative who's got a liver disease or whatever etiology, or has got a liver cancer sometime, especially in those who have a young relative who's got one of these two conditions, should get themselves tested for liver disease even if they have no symptoms.